Okay, hello everyone, and thank you for joining us today. Now, I do want to start by letting everyone know all audience members have their mics and cameras turned off. I'll just give everyone a minute to join in. I see lots of people coming in right now, so we'll let everyone get settled, and we'll come back to it in a moment. Welcome. All right, hello again, everyone. Thank you again for joining us. I see lots of people coming in, which is fantastic. Now, a reminder that all audience members have their mics and cameras turned off, and we'll be starting momentarily. Okay, so before we begin, a few need to know reminders. So please use the chat function to ask your questions and share your comments during today's session. Your microphones and cameras are currently disabled. During today's Q&A session, please raise your hand if you'd like to ask a question, and our team will enable your microphone and camera. You will then need to unmute yourself in order to start speaking. If you experience any technical issues today, first try to leave our webinar and rejoin it using the link in your confirmation email. If the issues keep persisting, if it's not resolved, please send us a message to our tech team at training@prospercanada.org, and they will try to assist you as soon as possible. Now, this meeting is being recorded and will be posted on our Catalyst site. Please see the instructions in the chat if you prefer to remain anonymous. Now, I have to say, we're incredibly excited that you're here joining us today as we discuss the Financial Wellness in First Nations, or FWFN projects, insights from the previous 2 years. Very, very excited and happy you're able to join us today, and wonderful to have our speakers with us. They're wonderful to work with, and you'll get to see that for yourself as they start talking. Today, you're going to hear from our project about our project's reach, outcomes, and impact on the culturally grounded, community-based financial empowerment services. These free services were delivered in Manitoba and Ontario through trusted relationships between local Indigenous partners and our non-Indigenous community partners that you're going to be hearing from today. At this time, I'd like to welcome Pamela Ort-McNabb from AFOA Canada to share opening remarks for today's webinar. Pam is the Vice President, Education and Training at AFOA and serves as a valued advisor to the Financial Wellness in First Nations project. Pam, over to you. Thanks for joining us today.
Thank you, Robbie. Good day. I'm honored to acknowledge the land that we're on today. AFOA Canada's offices are located on the unceded traditional territories of the Algonquin peoples. Today, I'm calling in from the traditional territories of the Haudenosaunee and Anishinaabeg, specifically Six Nations of the Grand River and Mississaugas of the Credit in Brantford, Ontario, where I have the privilege to live, work, and play. I'm grateful for their continued stewardship of these territories. As you're likely in different territories, we invite you to share your land acknowledgement in the chat. Thanks, Robbie.
Thank you so much, Pam. And echoing what Pam just shared, I'd also like to invite you to make your own acknowledgement in the chat if you are joining in from other areas. And you'll also see that message in the chat inviting you to do so. Thanks again, Pam. Okay, so let's take a look at our agenda. We will begin with briefly introducing you to each partner from the FWFN project that you will be hearing from today. We'll then offer an overview of the project and discuss the approach our team took towards evaluation. Next, we will take a look at what the project achieved over phase 2, discussing project outcomes and impact. This will lead us into the project insights from the last 2 years, including successes, challenges, and lessons learned. And importantly, you will hear directly from our partners as they will share more about their experiences and diligent efforts working on the FWFN project, illustrating the stories behind the results and insights you're going to be hearing about today. Then we'll discuss some practical implications and look ahead on where the project is going next. At that point, we'll open the floor to questions before a quick wrap up. Throughout today's session, if you do have questions, please post them in the chat. We will do our best to address as much as we can today and follow up by email to any that are remaining. And to answer a common first question, yes, we will share the slides and recording of this webinar. More on that towards the end of our time. Now, as you may not be familiar with Prosper Canada, I'll get us started by providing an overview of the work we do to help people build financial stability and well-being across Canada. As a national charity, our team at Prosper Canada has been working for over 30 years championing financial empowerment, supports, and services. We work with government community agencies, financial institutions, and other partners to improve access to financial supports, benefits, services, all that help people build financial stability and long-term resilience. Prosper Canada advances financial empowerment through research, policy development, systems change initiatives, and practical tools and programs that help individuals access benefits, file their taxes, reduce debt, build savings, strengthen their financial confidence. We also support frontline service providers and municipalities in integrating financial empowerment approaches into existing community and social services. Now let's take a moment to introduce you to the remainder of our speakers today. In addition to myself, Robbie Schiffman, and Pan from AFOA, joining us are Nicole Kovacs, Head of Research and Evaluation at Prosper Canada. Nicole has been the driving force behind the analyses and outcomes and insights you will hear about today. Next, we have John Coburn, Financial Empowerment Coordinator from Sudbury Community Service Center. Headquartered in Sudbury, John and his team work closely with local First Nations community partners to coordinate and lead a variety of financial empowerment services, including tax filing and access to ID throughout northeastern Ontario. Morgan Marshall is next, Tax and Benefits Program Manager at Community Financial Counseling Services. Alongside her team from Winnipeg, Morgan leads some of the country's largest free tax filing clinics, including specialized efforts to support local Indigenous communities throughout Manitoba. And last but certainly not least, we have Millie Acuna, Manager of Asset Building Programs at Seed Winnipeg. Also located in Winnipeg, the Seed team is dedicated to offering practical and accessible financial supports, including access to ID and financial education sessions throughout Manitoba. A big welcome to our speakers. Thank you for joining today and being a part of this great moment where we get to share about the project. Excited to be here with you. It cannot be understated that your thoughtful, flexible, and dedicated efforts are why we're gathered. These partners and their teams travel incredible distances, including flights and long road trips spanning hundreds of kilometers, navigating inclement weather, diligently planning alongside local partners, and much, much more to bring free, culturally grounded services directly to communities in Manitoba and Ontario. As you'll learn about the insights and outcomes they're represented from the work of the FWFN project partners, please keep this important context in mind as we're going through everything today. Now, before we share the insights, I would like to acknowledge with sincere gratitude all of those who helped make this project and its impact possible. We thank the Indigenous participants and community members who access services and share their experiences. Your trust and willingness to provide feedback ensure today's webinar reflects lived experience and real impact. We deeply appreciate the First Nation communities, local leadership, and community staff and volunteers who welcome this work, supported outreach, and help ground services in community priorities. We again acknowledge the leadership and collaboration of AFOA Canada, Community Financial Counseling Services, or CFCS, Seed Winnipeg, and Sudbury Community Service Center, SCSC, Your expertise, adaptability, and commitment were central to the service delivery, learning, and impact. We gratefully acknowledge the FWFN's principal funder, IG Wealth Management, and our funders from Ontario Securities Commission. We thank them for their generous investment and commitment. Their support has and continues to enable the expansion of culturally grounded, community-based financial help across First Nation communities. Together, these contributions reflect the shared effort and partnership that underpin the project's success we're going to talk about today. Now, before we really dive into things today and get started, we would like to hear from you and gather your insights and thoughts to this question. In your opinion, what are some factors that need to be considered when working with Indigenous communities in remote and rural regions? So you see the question on the screen. You can scan the QR code or use the shared link in the chat for your convenience. Once you have submitted your responses through Mentimeter, we're going to then share the results and we're going to discuss them together. Again, the question is, in your opinion, what are some factors that need to be considered when working with Indigenous communities in remote and rural regions? So you'll now start to see some of the live results come in. All right, great to see participation already happening. Thank you, everyone. All right, the big word is respect so far. It's jumping around a lot. All right, we'll give it a few moments. So again, the question here is, in your opinion, what are some factors that need to be considered when working with Indigenous communities in remote and rural regions? All right, so I see respect, culture, cultural understanding, history. Lots of participation. This is fantastic. I see accessibility, traditions, technology, access to service, adaptation, elders, trauma-informed, trust, history, relationship building. This is great. Thank you, everyone, for this input. So thanks for that. That was really insightful to see everyone's perspectives, and thanks for participating through Mentimeter so we could see that. Okay, so as we're going to be discussing the outcomes and insights from the project, keep this discussion in mind and think about these ideas and how they fit into the story of FWFN. Okay, so talking about the FWFN project a little further. So phase one of FWFN launched in 2021 with the support of IG Wealth Management to deliver culturally appropriate community-based financial wellness services in First Nation communities across Manitoba and Ontario. Today's webinar will be discussing the evaluation outcomes and insights from phase two of FWFN. That began in January 2024 and ended December 2025. This recent phase saw the expansion of integrated supports delivered through trusted partnerships between First Nation communities and community-based non-Indigenous financial empowerment organizations. Prosper Canada served as the project lead, AFOA the project advisor, providing critical insights to support project implementation. And CFCS, SEED, and SCSC served as financial empowerment implementation partners and worked with First Nation communities to deliver the project services and supports. As leaders in financial empowerment in Canada, project partners are committed to ensuring that First Nations across Canada have access to financial empowerment services they need to build their financial wellness, which is understood as a holistic concept seen as living a good life and having a good mind built on Indigenous values and culture and language. The following free services and supports were offered through the second phase of this project. First is tax filing assistance to obtain refunds and benefits, including supports to identify and access benefits beyond tax filing and overcome the barriers to accessing them through tax clinics and one-on-one sessions. The Remote Video Helpline. The Remote Video Helpline is operated in Manitoba by CFCS in collaboration with local partners, including Seed Winnipeg and the Canada Revenue Agency. These partner organizations served as Remote Video Helpline ambassadors, supporting community access, coordination, and on-the-ground setup to ensure individuals can connect with specialized support when in-person services are not available. Access to ID. Facilitating free access to birth certificates, social insurance numbers, and ID cards, including support to complete an application through a one-on-one session and community drop-in events. Financial literacy and coaching and counseling. These supports offered financial help on topics such as budgeting, RESPs, banking, and sudden wealth through free in-person and virtual workshops on one-on-one sessions. And then knowledge sharing and capacity building. Training and knowledge sharing events to build capacity and networks among First Nation community staff, volunteers, and non-Indigenous partners through Train the Trainer programs, virtual sessions, and also community practice knowledge sharing events. I'd now like to pass it over to Nicole, who's going to share more about the evaluation results.
Thanks, Robbie. Before I share the results, it's important to note that the evaluation findings represent an aggregate across all partner organizations rather than any one organization on its own. For this evaluation, we leaned on two main sources of data: quarterly partner reports and participant feedback surveys. Through quarterly partner reports, organizations shared how many people they reached, how much service they delivered, and what kind of support people received. They also shared insights on implementation and the wins and challenges of doing this work. The second source came from participants. After receiving support, participants were invited to answer one question: how did today's service affect you? We wanted to hear from people in their own words. This is where it comes together. The partner data tells us what was delivered. The participant voices tell us how it landed. When you put those side by side, you have findings that are grounded in evidence while keeping people and community context at the heart of it. As with any community-based evaluation, there are some limitations, including how data was collected across partners and real-world disruptions to data collection. These aren't weaknesses so much as important context for how we read the findings. With that grounding in place, let's turn to what we learned. Partners supported people in 62 First Nation communities across Ontario and Manitoba, with more than 10,000 Indigenous individuals receiving support through this work. Alongside service delivery, capacity was also being built. Nearly 300 Indigenous staff and volunteers took part in 164 learning events over the course of the project. Building local capacity is what makes financial help services sustainable, culturally responsive, and accessible over time. By strengthening the skills and knowledge of Indigenous staff and volunteers, training supported community-led service delivery and reduced reliance on external expertise. Tax filing was one of the key service areas in this phase and an important way for individuals to access financial benefits. Partners supported 4,570 people in filing well over 7,000 tax returns. That work secured more than $27 million in estimated new income, which is an average of almost $6,000 per person. A new service was introduced in this phase through the Remote Video Helpline. A total of 176 supports were provided to 80 individuals. The helpline removed barriers and improved access when in-person delivery wasn't possible for reasons like travel, staff capacity, and weather. So why does this matter? Tax filing is a critical entry point into the financial system. For many, income supports and benefits, it's the prerequisite. But historical and ongoing inequities have created real barriers. These supports helped reduce those barriers, strengthen trust, and open clearer pathways to financial wellness and long-term sustainability. Another critical area of support in this phase was helping people get identification. Partners provided ID support services to more than 2,100 individuals, submitting nearly 2,900 ID applications, addressing a foundational barrier to financial inclusion. Government-issued ID is a basic requirement for so much. Income supports, financial services, housing, healthcare, employment, all of it depends on having ID. But structural and administrative barriers, things like cost, documentation requirements, system complexity, have limited access to ID. By providing these supports, the project helped remove a key barrier and opened up access to the essential services people need to participate fully in daily economic and social life. Partners also supported 1,356 individuals through one-on-one financial counseling and coaching, and more than 2,000 community members took part in financial literacy workshops covering topics like budgeting, credit, sudden wealth, and debt. This is really important work. Financial literacy, coaching, and counseling help people build the knowledge, confidence, and skills to make financial decisions and handle financial challenges. For many, mainstream financial services can feel inaccessible or disconnected from lived realities, which limits the chance to learn and get support. By offering these supports, the project encouraged informed decision-making, eased financial stress, and strengthened capacity, helping build a foundation for longer-term financial wellness. As we mentioned earlier, this phase of FWFN included collecting feedback directly from people who received support. Participants were asked that single question, how did today's service affect you? We analyzed 841 responses, which gave us 1,241 thematic references, and looked for the most common ways people described the differences that were made. 6 themes came through most clearly: positive and trustworthy service, improved financial understanding and problem solving, meaningful and helpful support, taxes filed and brought up to date, gratitude for the service, and timely access to service. It's powerful to hear the impact in people's own words. You'll see in these quotes the emphasis on ease of service, the importance of going to communities, and the relief these types of services provide. Our thanks go to everyone who took the time to tell us about their experience after receiving support. In the evaluation report, you'll find additional themes and direct quotes from participants. It's a worthwhile read, and I really encourage you to do it because I think it will speak to you in the form of those voices. As we wrap up the data component of the evaluation, 5 key insights emerged, building on those from an earlier phase. These include: financial help services are essential and in high demand. They produce tangible financial gains alongside reduced stress and increased stability. Trust is the gateway to access. It requires intentional relationship building, time, consistency, and community leadership, including trusted local changemakers. This work isn't easy. Community-centered co-design services that are most effective and sustainable. Are most effective and sustainable. This is strengthened by community ownership and capacity building. And integrated one-stop super clinic models that you'll hear about in a little bit are a high-impact approach to scale. They improve convenience and wraparound access. And scaling must account for real-world constraints. It requires sustainable funding, flexible delivery models, blended in-person remote approaches, strong coordination and support for Indigenous-led service delivery where communities identify it as a goal. So data provides valuable insights, and I'm a lover of data, but the full story lives beyond the numbers. It lives in real people's experiences and realities. So I'll hand it over first to Morgan, and then John and Millie, who will share stories of impact and their perspectives from the front line.
Thanks so much, Nicole. Tax filing is the doorway to benefits and is an essential piece of working towards financial well-being for individuals and families. It can be a daunting task to undertake, especially on your own or when there is a significant fee attached to getting it done. This project has offered the opportunity to bring tax filing familiarity and expertise of our organizations out into communities to provide tax filing and benefits navigation support for free. We deeply respect our partners in community who have been essential to this work, sharing their knowledge, arranging for appointments, space, advertising, and event support. While we wish we could be everywhere, there are limitations to how often and how far we can travel. So it's also been important to innovate and develop alternate mechanisms to still be connected to community members when we can't be there in person or when we aren't able to meet with everyone. One of these mechanisms is the remote video helpline, where we set up video meetings between our team in Winnipeg and a computer out in a community setting. We have the ability to send laptops out with our partner organizations like Seed Winnipeg or the Manitoba CRA Outreach Team when they travel to locations we can't, or some communities have available computers in an office or computer lab. It allows us to be face-to-face and offer the connection to more people and places than we'd otherwise be able to. I'd like to share with you a story of our team's implementation of the remote video helpline. During a video tax clinic in a remote rural community, a single mother with 4 children needed 5 years of tax filing to be completed. She was experiencing significant financial strain at the time. With support from a Canada Revenue Agency representative, we were able to complete her Canada Child Benefit application to make sure that she was receiving the CCB correctly for all of her children. By then filing her taxes and having that CCB application completed, she became eligible to receive a total of $110,000 in retroactive benefits, including the CCB, GST credits, and the carbon rebate. This support significantly improved her family's financial stability. This is just one of the many people we were able to support, highlighting not only the importance of tax filing itself to ensure benefits are received, but also that there are opportunities such as the remote video helpline to make free financial empowerment supports accessible in innovative ways. I'll now ask John to share a story from his experience coordinating with local partners on the project. Over to you, John.
Thanks, Morgan. So I'm going to talk today about the outcomes we achieved over the last 2 years and how they're directly connected to the strong relationships we've formed with First Nation communities and other local agencies, allowing us to coordinate services and meet community needs as best possible. On the screen is an example of how our team continues to work closely with other service providers to plan a multi-service community event, which we call a super clinic. Through a strong partnership with Service Canada, the program is expanding to access this essential services in some of the most remote communities in Northern Ontario. Delivered in collaboration with Service Canada, Canada Revenue Agency, Service Ontario, and other community-based programs, the clinic will bring multiple services together in one place, making it easier for people to access the supports they need without costly or even impossible travel. Building on the success of previous clinics, this effort represents one of the most comprehensive service delivery initiatives in the region in recent years. Our team actively communicates regularly with fellow service providers so we can connect and collaborate and plan these super clinics. We've even started chats on Teams and Facebook Messenger to easily stay in touch with each other. We coordinate a variety of agencies, including Service Canada, Service Ontario, Canadian Mental Health Association, CMHA, Ontario Works, and Canada Revenue Agencies, plus a number of other local community agencies that are there. With the central goal of offering the most comprehensive and complete package of service clients might need. Having other service partners with us alongside us in these communities allows for seamless transfer between agencies as we determine what help they need. And this is especially impactful when we're able to build off each other's efforts when we identify that a clinic is missing, or a client, is missing information. So for example, Service Canada can help secure the client's social insurance number for a client. Maybe they forgot it or they don't have it, and then direct them to our team to get their taxes done. At which point we find out that we need to channel the client over to Service Ontario with help in securing identification, who then in turn can find out that they're missing something else and channel them over to the next available partner that's with us at the super clinic. And it just makes the helping seamless and easy and so much better than having to go to different clinics all over the place in different locations. Each of these services is offered for free. We're there in person in the community, and we're sending up experienced team members who understand the challenges the community may be facing. And now I'd like to invite Millie to share about the importance of these financial empowerment services being flexible to community needs.
Thank you, John. One key ingredient that has allowed us to successfully support the communities has been our ability to adapt services to respond to community needs. Here's one story from Seed's experience that I hope provides further insight. During the delivery of financial literacy programming, some community members were experiencing significant and immediate financial pressures, including the risk of essential service disconnections. These realities reinforce the importance of grounding financial education in lived experience rather than theoretical instruction. Open and honest conversations about budgeting, led by staff who could share their own experiences, fostered empathy, reduced stigma, and strengthened trust. The foundation behind this ability to adapt and respond is the relationships we've built with communities. It's one of the elements that I've enjoyed most over the years working on this project. Even though we connect in different ways through group learning, ID supports, or individual financial coaching, each relationship is genuinely unique. And over time, these connections have grown into trust. Communities see that our team is committed, that we're showing up year after year, and that we're bringing financial empowerment programs that truly respond to their needs. Trust has made a big difference, and over time, our community contacts and participants have become more confident and willing to reach out to us for advice, guidance, and support. And often it's not just the formal sessions that matter most, it's the informal moments. I, for one, enjoy the hallway conversations or what we like to call our Bannock talks, where people feel comfortable opening up about their financial challenges. And those conversations have helped create safe and welcoming spaces. Through those experiences, we've become better prepared to offer meaningful support, whether that's sudden wealth workshops, helping navigate benefit systems, managing debt, or finding solutions for unexpected expenses. In turn, these relationships have helped us better understand the cultural and economic realities the communities face too. And a great example of this in Manitoba, when working with First Nation communities, we saw that many caregivers, like grandparents, didn't have formal legal guardianship documents. Because of that, they couldn't access benefits like the Canada Child Benefit or even obtain ID for their children in their care. We work collaboratively with Manitoba Vital Statistics to advocate for a new process. As a result, a solution was created that now helps caregivers in these situations access the supports they need. It's a strong example of how working together can remove systemic barriers. We also know that access to financial empowerment services can be challenging, whether due to geographic isolation, transportation barriers, limited resources, or cost. And that's why we're so proud to be a consistent and reliable presence in the communities we serve. But beyond all the impact and outcomes, what I treasure most are the personal connections. We've shared so many meaningful moments being part of Bannock making competitions. Like cookums are coming out to me saying, try my recipe, Millie. Exchanging Filipino cooking tips because they also want to learn from me. Talking about our children's passion for sports and so much more. And those moments have turned these relationships into something much deeper. It really feels like a community of family and relatives, not just program partners. And so I'd like now to pass it back over to Robbie to share a few key takeaways from today.
Thanks so much, Millie, and thanks again to John, Morgan, and Nicole. Thank you for the powerful results we've just heard, the powerful insights from our partners on the ground with their experiences, really illustrating the points behind the results that Nicole was covering. Thank you. That was really, every time I get to hear it, I just really enjoy it as well. The work you do is really, it's encouraging. It's brings a lot of passion and enthusiasm to this. So thank you. I'd like to now offer a brief recap of what we've heard about today. So overall, the FWFN project continues to demonstrate that delivering community-based financial supports directly within First Nation communities are effective and valued, especially in the form of coordinated one-stop service delivery models, such as what we called the Super Clinic. The project has also worked to strengthen capacity through training and knowledge sharing activities. These encourage learning and collaboration among non-Indigenous service providers and local First Nation community partners. Moving forward, a longer-term goal of the FWFN project is to support capacity within Indigenous communities to independently deliver financial help services where communities identify that this is a priority and have the capacity to pursue it. Importantly, today's webinar underscores the complexity of delivering services in rural and remote contexts. Demand consistently exceeds capacity, highlighting the need for sustained funding, workforce stability, and specialized expertise. Flexible service delivery and long-term commitment are central to meeting community needs and maintaining trust, similar to what you heard from John, Millie, and Morgan. I'm also really pleased to share that through the addition of funding from the Ontario Securities Commission, we've been able to expand the project to support Indigenous communities in Northwestern Ontario through our partners from Thunder Bay Counseling, who I know are in attendance for today's webinar. Thanks to the continued investment for our funders in IG and OSC, FWFN continues to support Indigenous communities in Ontario and Manitoba. We hope that today's session and insights encourage thoughtful growth in this work to further improve financial wellness within First Nation communities at the speed of trust. And now we'll have some time to look at questions that we've been receiving throughout today's session. So if there are any questions, please do add them to the chat now, and we can see how many we can respond to at this time. I think we have a good amount of time to take questions, which is really great, and it's something we were really looking forward to. On the screen, you're also going to see a QR code with access to the FWFN Insights report, which Nicole was referencing earlier, and is the underpinning of today's webinar. So please do take the time and look through it. There's the full report and the summary report that you have access to, provided in English and in French. Okay, so let's take a look at questions that we're receiving. I think I saw a couple come in earlier, but please do submit them as you think of them. You can also raise your hand if you want to unmute.
Thanks, Robbie. Karen asks, how did people access one-on-one coaching?
That's a great question. I'm wondering if one of our partners wanted to take this one.
I'd love to. Because it was never just one sort of format of financial coaching. Financial coaching could appear if they're attending a super clinic and they wanted to pull me aside and have a discussion about their personal challenges. It could also look at when we do group-based learning and we're delivering a financial literacy workshop, then that's what I call those hallway conversations where, like, Millie, I'd love to see you after the workshop if I could share with you a personal situation. We've also done some capacity building with volunteers and community staff where they've been trained through our Train the Trainer program, and ultimately financial coaching could happen through them as well. And then it's also video or phone calls. So they've established a relationship with us. They'll reach out through email or phone and say, hey, Millie, you said I could call. And so we've had a conversation over the phone as well, or even virtually, and when that's available. So very different channels of an opportunity for financial coaching one-on-one.
Thanks, Millie. Did any of the other partners want to add to that, or shall we move on to the next question? Okay, let's go to the next question. Erin, what do you got for us?
Yeah, Haley asks, says, thank you for sharing these great outcomes. Were there any key learnings or recommendations that came out of the work, such as for policymakers?
That's a great question. Wondering, Nicole, do you want to speak to this one? Or one of the partners?
Yep, I'm happy to do that. In terms of a policy, we haven't necessarily looked at the results from that perspective, like what are the policy implications. But when we do take a look at things like some of those insights, especially around, and in the report, what you'll see is there's a series of learnings, also barriers and challenges. And so when we look at those, I really do think that those end up becoming some of those policy pieces related to how this work can and should happen moving forward.
Thanks, Nicole. Yeah, and I think a lot of what we've heard today from partners, about the trust relationship building that goes into the foundation of that service delivery. It's so critical. I think it's one of the key pieces. And like Millie was just sharing, the versatility of providing support in the way that is appropriate, and is the communicated need. That's been, so insightful to this project.
We've got lots of questions. So Angel asks, what have you found was the biggest challenge in accessing these benefits? And so Angel, not sure if you mean for the individuals themselves and community or for the service providers that were helping to create access to benefits, but there might be two sides to that question.
I'm wondering if maybe Morgan or John want to comment on access to benefits.
Yeah, I can go ahead. So I think it's about getting into talking with the client and figuring out what are the benefits that they qualify for and what they're missing. And like Morgan said earlier, taxes is the gateway sort of to everything, right? You want to access benefits, at least in Ontario, you have to have your taxes up to date. You want to access, I don't know if it's GST or Trillium in Ontario, your taxes have to be done. You want to get on Ontario Works, your taxes have to be done. You want to collect Canada Child Benefit, your taxes have to be done. So taxes seems to be a foot in the door when we're getting to different areas, because so many people can relate to getting their taxes done and needing to have them done. And it's also the first step in understanding what benefits are out there that they may qualify for and that they can access on their own. I know also Prosper has a great thing called the Benefits Wayfinder, which helps identify with some simple questions entered which benefits might be available for the individuals, your clients, and really gets you, on the path to figuring out which benefits are going to apply for them. I don't know, Morgan, if you want to add to that.
No, I totally agree with that. And I think that the sort of usual things that we find the biggest barriers for are, people needing to have ID before they can sort of start the process of tax filing, or they need to get social insurance numbers and those kinds of prerequisites for tax filing and then accessing the benefits. I know we have also found that with individuals who have perhaps their physical address is in a more rural or remote area, but then they have a mailing address in a larger city center like Winnipeg, that can then sometimes introduce just timeline difficulties in terms of receiving documentation, letters, submitting applications, and that sort of thing between where they're actually staying and where their mail is going. So some of those barriers and issues can be a challenge as well, which is another reason why these super clinics can be such an impactful opportunity, because you can have us there as well as Service Canada, as well as CRA, people who are able to access the digital versions of many of those letters or notifications that might have come in, so we can help navigate different situations and troubleshoot what barriers people might be facing at a time.
Thanks, John and Morgan. Erin, what do you have for us next?
So Mark has a question about the amount and scale of resources required to do this work in remote areas. I'm curious to know more about how difficult it is to obtain these services or to deliver the services in remote areas versus urban-only services. Can you share about the amount of resources involved? For example, the length of phase 2 of the project, the number of full-time employees, number of volunteers, transportation expenses.
I'll open that up to the partners who will be best suited to answer related to the all the logistics and planning that goes in.
I'd love to speak to this. So at the beginning of the project, I'd say we started off with about 4 to 5 team members, and then recognized quite quickly that we needed folks who had a license and primarily had experience in driving in rural areas. So there's a difference in city driving and rural driving with gravel roads. At one point, I remember traveling on my own and recognized that there are several areas where there is no Wi-Fi or data available. So there were pieces like, something could happen to me and no one knows where I am. So that was a lesson learned. And so we quickly expanded our team to make sure that if it is quite a distance, we're traveling in pairs now. but ultimately, it's such a great community where folks are well aware, communication, literally the use of Wi-Fi services in the car. We've found to be very adaptable in some of our situations. Transportation expenses, yes. So it can be expensive, and now a lot of our partners such as Service Canada, CRA, they're even offering to carpool with some of our communities. And often the communities are so happy to have us. They offer accommodations. They're opening their family homes to us, nursing stations, school accommodations. And often they'll even say we have a budget for help with travel. So they'll provide mileage or even airfare in some of our most secluded areas. So it really has been a collaborative effort to bring financial empowerment programs to the communities. So right now we expanded from 4 to 5 staff to now 8. But not to mention all the wonderful volunteers and community members that are the change makers. Those are the ones that really make this happen. So just wanted to give them the heads up or give them the kudos.
Thanks, Millie. I think even John has talked about ice roads as well. If Morgan and John, if you want to add to that, go for it.
I think Millie summed it up really well. I mean, I haven't had the chance to drive on an ice road yet, but it's on a bucket list for sure. So but to give you an idea, Mark, like to drive to where I would go on an ice road is about a 13-hour drive from where I live, versus I can take a 3-hour drive and then a 45-minute flight to get into where I'm going to go. So flying is definitely it, but we've also faced environmental and weather delays, snowed in, rain. Right now is forest fires, flooding is all really been a challenge. And one of the things we've tried to do is see the good in these evacuations that the communities are going through and bring our services to where they're being evacuated to. So a lot of the communities that we serve end up in other more urban areas closer to us. So we'll rearrange our schedules and kind of make it happen so that we can be in those communities where they're staying in a hotel or a hostel or something like that, and bring the services there to them so that they're still getting those services and maybe less on our budget so we can do it more often.
Thanks, John. Morgan, did you want to add to that? I know a lot got covered there. John, thanks for bringing up about the kind of being reflexive to evacuations and that we've seen a lot, especially recently. Yeah, Morgan, did you want to add, or are we ready? We can move to the next question.
I think the only thing that I would have to add is just one of the themes perhaps you've noticed is just being adaptable and flexible to what is needed, both because of forest fires, flooding, weather, blizzards, as well as what the community is needing. And so that's sort of where the remote video helpline for the tax service also kind of was born from, in that idea of, okay, what happens when there is a blizzard and we had a clinic scheduled and we can't physically get there? How do we still make sure that we can provide access to communities who were, expecting us to be there, who trust us to be there? So that was another one of those sort of outside of the box thinking opportunities to try and figure out how to keep service going.
Thanks, Morgan. Erin, what do you have for us next?
All right, so Linda has a question about benefits navigation, particularly regarding disability-related benefits, such as a disability tax credit and provincial disability benefits. She says, I'm experiencing challenges with medical professionals working on Nation who act as gatekeepers to disability benefits and express misinformed opinions that the individual is just looking for money. These medical professionals are not Indigenous.
I'll turn that over to the partners. Thanks, Erin.
I can. Oh, go ahead, John.
You go ahead, Millie.
Okay. Ultimately, yeah. So we have been finding, number one, awareness that the DTC is available and the process. So there's a lot of learning and sharing of this information that we're finding is really needed. But what you're speaking to regarding the medical professionals, it is consistent with what we're seeing as well. And so we're trying to speak to the communities in terms of who is their medical supports, what are our options that are nearby. We're exploring other means in terms of tools, resources in Winnipeg where we can try to disseminate into our First Nation communities. So it actually is an ongoing project that we've identified is a need, and we're working with that with some of our partners in the city. So I don't have an answer for you yet, but we're working on it. But yes, it is a consistent challenge that we've been noticing. But they're just so grateful to learn that this benefit exists. And ultimately, with the tax filing services, and when they do get the DTC, how impactful it is financially and overall getting the supports they need in place. So we're really working towards just ultimately increasing that access to the benefit. Stay tuned to the next webinar.
John, did you want to add to that, or does that cover it?
Yeah, that covers it. I was going to say the same thing, Millie. Like we're seeing some friction with the local medical practitioners not wanting to fill out the forms and thinking it's just a money grab when it really isn't. So it is consistent and seems to be happening everywhere we talk to. And there's no solution yet, but like Millie said, we're working on it, trying to figure out a way to make that transition and that cooperation more seamless.
I'll also just jump in to add a shout out to an Ontario-based doctor, Dr. Gary Block, who has done a lot of work in this area of trying to make medical professionals aware of the importance of financial well-being as it then ties to the social determinants of health and physical, mental, emotional well-being. And so based on his work, we have a project called the Get Your Benefits Project that our organization operates, and it is a printed physical booklet of different resources that all sort of tie into financial well-being as well as other services that support that. And there's also intention and work, like Millie commented on making sure that this information and knowledge is shared with medical professionals so that they understand what it is that CRA is going to be looking for when they actually review those disability tax credit applications, as well as the importance of these benefits and getting that message through that, you know, it's not just a money grab, as your words say, Linda, but that it's really a fundamental and essential benefit that then ties into the physical, mental, and emotional well-being of individuals as well. So no solutions, but certainly a lot of people who are working on this issue, and hopefully collectively we'll be able to make some strides forward.
Thanks, Morgan and John and Millie. Aaron, do we have time for maybe one more?
Yeah, Samantha has a question about the logistics for the remote video helpline. Do you have multiple service providers available to respond to the inquiries during hours of operation? Or is it a person who answers calls and provides referrals and warm hands off to partner organizations? For more complex situations where the caller may have need for successive steps or interventions, how is progress followed and continued for that individual? And just tagging on, Mark had a question about ID services. Just kind of curious to know more about how that's implemented.
Okay, well, I can start us off with the remote video helpline. Great question, Samantha. This project has gone through a couple of different iterations as we sort of originally conceived of the idea and then presented it to partner organizations as well as communities, and then started the process of actually figuring out what would work. So right now, the primary service that we offer through this video call opportunity is tax filing and access to benefits. If there are additional components that we determine through the conversation with the individual that they would really benefit from, then we can arrange for handoffs to other partners, connections to, Seed Winnipeg or over to Service Canada, mental health supports, etc. But our helpline itself that Community Financial operates is focused around the tax filing and access to benefits. So we have a couple of different ways that it operates. One is when we actually send a laptop kit out with a partner organization. So Millie, if she's going out into a community to do some money management training, she might take one of these kits out with her. And then simultaneously, while the money management training is happening, we're also running a video tax clinic. So we have video meetings that are set up through Microsoft Teams on that laptop, and then the community members come and sit down. We really, really value then either our ambassadors like Seed or community partners who are there and able to sort of manage the queue for us, if you will. But then we're able to have sort of that quasi face-to-face interaction, like those sort of hallway conversations, if you will, where we can get people up to date on filing their taxes, do a full benefits assessment to determine whether there's anything else that they might qualify for. And then again, through that conversation, if there becomes a clear need for deeper coaching or counseling or connections to other supports, then we would arrange for those connections to be made at that time. We also recently have had the ability for a couple of communities who tried out this mechanism and it really worked well, where they have a computer in, their office location, perhaps in a band office or an employment and training office somewhere, or a computer lab, where they will then set up, say from 10 till 3, it's going to be open, walk in, first come, first serve, or they might take appointments, and we will have our team on this end set up on those video meetings, just ready for people to come in and join. So it's still at this point primarily through intentional scheduling of a remote video session versus a line that is open, 5 days a week from 9 till 5 that anyone can call in at any time. But we're continuing to explore and hear and learn from the communities as to what works for them, and our goal is really to make our services as accessible as possible through whatever means is necessary to be able to deal with, all of the other extenuating circumstances that might mean we're not out in community.
Thanks, Morgan. So I'm mindful of the time. We're actually getting close to 2 o'clock. So Aaron, thanks for your support with the questions, and Morgan, Millie, and John and Nicole, thanks for the input on the answers. Those who did post the questions in the chat, I know there's been so many, which is fantastic to see. Thank you for submitting those. We do plan to respond to and follow up by email, so you will hear from us. So just moving forward, just to make sure we're on track to give everyone their ability to get back to things at 2 o'clock Eastern time, I should say. Okay, so moving forward, so a couple little housekeeping things to complete on. We wanted to also share about there's some Resilient Futures funding that's available. We've posted this for application, and it's based out of Northwest Territories in Atlantic, Canada. The deadline to submit is June 22nd. There's QR code on the screen. You can also visit the website listed here for more information. If you have any questions about it, you can find contact details there as well. We'd love it if you could share this news with your network and help us spread the word about this opportunity. So wanted to share that with the group today. Also, please share more with us. We want to hear your feedback about today's webinar. If you liked it, if you'd like to hear more, if you'd like us to talk all day, or if you'd like us to talk less, whatever it might be, but please send us your feedback. We'd love to hear from you about today's webinar. Scan the QR code on your screen or follow the link that's in the chat. We really appreciate that input. And finally, we will share the slides and recording of this webinar with all participants within a few days via email. It will also be available on Catalyst's our online community, bringing together financial empowerment experts from across Canada. If you haven't already, please scan the QR code or visit the website catalyst.prospercanada.org and create an account and join the community. You can do that today. So with that, thank you everyone for participating. There are speakers. Thank you for all of those who answered questions, engaged in the activity we did earlier. Thanks for everyone who contributed on this project and making this webinar possible. We really appreciate your time today and hope you have a good rest of the day. Thank you.